Hey guys, let's talk about laryngomalacia. Laryngomalacia is a congenital abnormality of the laryngeal cartilage. This is the most common congenital abnormality of the larynx. Due to softening of the laryngeal cartilage, it predisposes to dynamic supraglottic collapse during the inspiration. It presents in early infancy with the maximum symptoms at 6 to 8 months of age. Main and most important symptom is inspiratory stridor. Other associated symptoms are difficulty feeding, apnea, cyanosis, poor weight gain, aspiration, and GERD. How do we diagnose it? Diagnosis is made by clinical features and flexible laryngeal endoscopy or direct rigid laryngoscopy under anesthesia. How do we treat it? The treatment is more of conservative and reassure the parents because the laryngomalacia disappears by 2 years of age by itself. But till then, if episode occurs, tell the parents to put the child in prone position and it will help the baby to breathe and will improve the stridor.